After more than 3 decades working across surgical wards and rehabilitation units, I've come to understand something that most people never hear until they're already dealing with the consequences. The moment seniors begin losing strength and stability rarely happens during physical activity. It begins before they ever leave the bed. I've worked with patients who had been walking independently for years, confident, capable, self-sufficient, who suddenly found themselves struggling with balance, morning stiffness, and unexplained weakness. When we trace those patterns back carefully, age was only part of the story. What stood out consistently was how their bodies were transitioning from sleep to movement each morning. Many of them shared the same observation when I asked, Dr. Hayes, I stretch every morning, and stretching is genuinely helpful. I want to be clear about that, but here is the distinction I wish more people understood before mobility problems develop. Stretching lengthens tissue. It does not necessarily activate it. Activation means switching muscles on, signaling them to stabilize joints, support circulation, and prepare the nervous system to coordinate movement before any weight is placed on the body. Without that activation, the first steps of the day happen with cold, unresponsive muscles, reduced joint support, and a nervous system that hasn't yet established reliable communication with the limbs. That is the window when instability quietly increases and injury risk rises without any warning. In clinical mobility recovery programs, seniors who performed targeted activation movements before standing demonstrated measurable improvements in coordination and lower limb responsiveness compared to those who relied on passive stretching alone. These are not intense workouts. They are controlled bed-based movements designed to stimulate blood flow, engage the neuromuscular system safely, and restore brain-to-muscle communication before weight-bearing begins. One movement in particular stood out consistently when reviewing functional mobility outcomes. It produced stronger lower body engagement and better stability responses than any other exercise in this category. That movement holds the #1 position in today's ranking, and the reasoning behind it may genuinely surprise you. Today, we are going to reveal and rank 5 bed exercises from least impactful to most effective. And I want you to stay with me through number 2, because that exercise could meaningfully change how steady you feel the moment you stand up each morning. I'm Dr. Lauren Hayes. Let's begin. This first movement may appear almost too simple to matter. I encourage you not to let that impression cause you to dismiss it, because ankle pumps and circles are precisely what orthopedic surgeons prescribe to every patient following hip or knee replacement surgery. And there is a very specific clinical reason for that. When the body lies in bed for an extended period, blood begins to pool in the lower legs. The calf muscles, which function as a secondary circulatory pump, are not contracting. Blood sits stagnant in the veins. Research published in the journal Thrombosis Research confirmed that adults over 75 who spent more than 8 hours in bed without lower leg activation had a significantly elevated risk of developing deep vein thrombosis, a dangerous blood clot that can travel to the lungs and become life-threatening. Ankle pumps directly address this by activating the calf muscles and pushing blood back toward the heart. Here is how to perform them correctly. Lie flat on your back with your legs extended. A pillow beneath the knees is fine if that is more comfortable. Point your toes down toward the foot of the bed as far as they will comfortably go. Hold for 2 seconds. Then pull your toes back up toward your shins as far as they will reach, and hold again for 2 seconds. That is 1 pump. Complete 10 repetitions, then transition into slow clockwise circles for 10 rotations followed by 10 counterclockwise. The critical detail most people miss is pace. When ankle pumps are rushed, they become little more than foot wiggling. When performed slowly and deliberately through the full range of motion, they activate not only the gastrocnemius and soleus muscles of the calf, but also the smaller stabilizing muscles surrounding the ankle joint. Research from the American Academy of Orthopedic Surgeons identified these stabilizers as responsible for nearly 60% of standing balance control, and they are among the first muscles to weaken after the age of 75. 3 complete sets every morning before standing. That is your foundation. If your knees feel stiff when you first wake up, ache during the early part of the morning, or make grinding sounds during movement, this exercise will become one of the most valuable things in your daily routine. Supine heel slides move the knee through its complete range of motion while the leg remains fully supported by the mattress. Gravity is not compressing the joint. Body weight is not loading the cartilage. The movement is entirely controlled and safe, which is precisely why orthopedic specialists consider them essential for anyone managing osteoarthritis, a condition affecting tens of millions of older adults with the highest prevalence in those over 75. Research published in the Journal of Orthopedic and Sports Physical Therapy found that patients over 70 who performed heel slides daily for 12 weeks experienced a 35% improvement in knee function scores and reported significantly reduced pain during everyday activities, including walking and stair climbing. To perform them, lie flat on your back with both legs extended. Slowly bend your right knee by sliding your heel along the mattress toward your body, keeping the heel in contact with the bed throughout the movement. Bring it as far as you comfortably can without forcing or causing sharp discomfort. Hold for 3 seconds at the top, then slowly return the leg to its starting position. The return is just as important as the slide. This controlled lowering builds eccentric quadricep strength, which is exactly what the legs need to manage descending stairs or lowering into a seated position. 12 repetitions on each leg, 2 full sets. Focus on keeping the kneecap pointing directly upward throughout the movement. When the knee drifts inward or outward during the slide, it places uneven stress on the cartilage, and that uneven loading over time is what accelerates joint degeneration. One more point worth understanding: the synovial fluid inside your knee, your body's natural joint lubricant, only circulates properly when the joint moves through its full range. During sleep, that fluid thickens and becomes less effective, which is the direct cause of that familiar morning stiffness. Heel slides performed before you stand essentially pump fresh synovial fluid through the joint, warming and lubricating it before any weight is placed on it. That stiffness is not inevitable. You have a daily tool to address it before it affects your movement. This exercise targets a muscle group that the majority of adults over 75 almost never train directly, which is precisely why those muscles become so dangerously weak over time. Supine marching strengthens the hip flexors, the deep core stabilizers, and the lower abdominal muscles through slow, controlled marching performed while lying on the back. A landmark study published in the Journal of the American Geriatric Society, following over 2,000 adults aged 75 and older, found that hip flexor weakness was the single strongest predictor of future falls, more predictive than general leg strength or balance test scores. Your hip flexors are the muscles responsible for lifting your legs during walking. When they weaken, the walking pattern shifts from proper stepping to shuffling, and that shuffle, feet barely clearing the ground, means that any slightly uneven surface, any small threshold or rug edge becomes a genuine tripping hazard. To perform supine marching correctly, lie on your back with both knees bent and feet flat on the mattress. Place your hands lightly on your lower abdomen. This provides feedback about whether your core is actually engaging. Slowly lift your right knee toward your chest, bringing it as high as you comfortably can while keeping your lower back pressed firmly into the mattress. That contact point is the most important technical detail in this exercise. If your lower back lifts away from the bed as your knee rises, the core is not engaging and the hip flexor is compensating by pulling on the spine, a pattern that can contribute to lower back pain over time. Keep the back flat. Hold the knee at the top for 2 seconds. Lower slowly and repeat on the left side. Build toward 15 repetitions per side, 2 sets. Focus especially on the controlled lowering, which is where core activation is highest. Research from the University of Pittsburgh found that seniors who performed controlled hip flexion exercises for 8 weeks improved walking speed by an average of 22% and reduced fall risk by nearly 40%. Those improvements translate directly into real-world independence. If there is one muscle group that orthopedic surgeons consistently identify as the primary gatekeeper of mobility after 75, it is the quadriceps, the large muscles along the front of the thighs responsible for straightening the knee, supporting body weight during standing, and controlling the descent when sitting or going downstairs. After the age of 70, quadricep strength declines at approximately 3 to 5% per year without active maintenance. A clinical study published in the journal Age and Aging found that adults with weak quadriceps were 3 times more likely to require assistance with basic daily tasks and 5 times more likely to need a mobility device within 2 years. Straight leg raises performed in bed are one of the safest and most effective ways to address this decline, with zero stress placed on the knee joint, which is why they form a cornerstone of virtually every orthopedic rehabilitation program worldwide. To perform them correctly, lie flat on your back with one knee bent and that foot flat on the mattress for support. The other leg is extended straight. Tighten the quadricep on the straight leg by pressing the back of that knee down into the mattress. You should feel the muscle firm up along the front of the thigh. Then slowly lift the entire straight leg until it reaches approximately a 45-degree angle or is level with the opposite bent knee. Hold for 3 to 5 seconds at the top, feeling the sustained tension in the quadricep. Then lower the leg slowly over at least 3 seconds. Do not allow it to drop. That controlled lowering phase produces the eccentric muscle load that research from McMaster University identified as generating significantly greater strength gains in older adults compared to the lifting phase alone. 10 repetitions per side, 3 sets, 30 seconds of rest between sets. A 6-month trial published in the Journal of Rehabilitation Medicine found that seniors performing progressive straight leg raises showed a 47% increase in quadricep strength and were 61% less likely to experience a fall-related injury compared to those who performed stretching only. If there is one exercise that orthopedic surgeons, physical therapists, and geriatric specialists consistently agree upon, if you could perform only a single bed-based movement for the rest of your life, it would be the glute bridge. This is not simply a glute exercise. The glute bridge is a full posterior chain activator. In a single movement, it simultaneously engages the gluteus maximus, the hamstrings, the lower back extensors, and the deep spinal stabilizers. And the clinical significance of that combined activation cannot be overstated. A major clinical trial published in The Lancet, tracking over 3,000 adults aged 75 and older, identified posterior chain weakness as the #1 modifiable risk factor for both falls and loss of independent living. Not cardiovascular fitness, not flexibility, not general leg strength, specifically the strength of the muscles running along the back of the body from the lower back through the glutes and hamstrings. When these muscles are weak, the pelvis tilts forward, the spine loses its natural curvature, balance shifts forward, and the body gradually begins to fold in on itself. The forward rounded posture seen in many older adults is not simply a cosmetic concern. It directly destabilizes the center of gravity and makes falling progressively more likely. What makes this particularly urgent is that the gluteal muscles are among the fastest declining muscle groups after 75, largely due to extended periods of sitting and reclining. Research from the University of Southern California found that the average person over 75 spends more than 10 hours per day seated or lying down. During all of that time, the glutes are essentially inactive. Researchers refer to this as gluteal amnesia. The brain gradually loses its ability to efficiently recruit these muscles because they have been dormant for so long. The glute bridge is the most effective tool available to reverse that pattern, even after years of inactivity. Here is how to perform it correctly, and more importantly, how to avoid the most common errors that cause most people to miss the majority of its benefits. Lie on your back with your knees bent and feet flat on the mattress, approximately hip-width apart. Position your feet close enough to your body that you could almost graze your heels with your fingertips. Before lifting anything, squeeze your glutes as firmly as you can, as if you were holding something tightly between them. This pre-activation step is not optional. Without it, the hamstrings and lower back take over the movement and the glutes contribute minimally, which defeats the entire purpose of the exercise. Once you feel that firm squeeze established, slowly press your hips upward by driving through your heels, not the balls of your feet, until your body forms a straight line from your shoulders to your knees. Hold the top position for 5 full seconds while maintaining the glute squeeze and breathing normally. Many people hold their breath during this hold, which can cause unnecessary blood pressure elevation. Then lower yourself slowly over 4 seconds. Just before your hips make contact with the mattress, drive immediately back up into the next repetition without resting at the bottom. This continuous tension approach, identified by researchers at the University of Queensland as 40% more effective at activating the gluteus maximus compared to resting between repetitions, is what separates a genuinely therapeutic glute bridge from one that produces minimal results. Begin with 10 repetitions for 3 sets, resting 45 seconds between sets. As strength improves over the following weeks, progress to single-leg variations, or place a pillow between your knees and squeeze it during the bridge to simultaneously activate the inner thigh muscles and improve pelvic stability. The outcomes from consistent glute bridge practice are among the most significant in all of geriatric exercise research. The same Lancet study found that participants performing glute bridges 5 days per week for 6 months experienced a 58% reduction in fall risk, a 44% improvement in walking endurance, and, most meaningfully, a 71% reduction in the likelihood of transitioning from independent to assisted living. These are not modest improvements. These are numbers that represent the difference between living on your own terms and losing that freedom. There you have it. 5 bed-based exercises that clinical research consistently identifies as more important than stretching alone after the age of 75. Stretching has genuine value. I want to be clear about that. But flexibility alone does not build the strength, joint protection, and neuromuscular stability that an aging body needs to remain mobile and independent. These 5 movements, ankle pumps, heel slides, supine marching, straight leg raises, and glute bridges, address every critical area from circulation and joint health to core stability and posterior chain strength. The complete routine takes less than 15 minutes. No equipment is required, no gym membership, no painful workouts, just consistent, targeted movement performed every morning before your feet touch the floor. Start with whatever number of repetitions feels manageable. If that is 5 repetitions of each exercise on your first morning, that is the right starting point. The most important thing is that you begin and that you do not stop. Progress arrives faster than most people expect. Within a few weeks, getting out of bed will feel less effortful. Walking will feel steadier. Daily activities that previously felt draining will begin to feel manageable again. Your future self will be grateful for every single repetition. If this information was helpful to you, please subscribe to the channel so you never miss content like this. Thank you for being here. Dr. Lauren Hayes.